Good afternoon, everyone. Thank you for joining us today and happy National Mentorship Day. We are so pleased that you could make it. Thank you to our supporters, our board members for joining us, and to our scholars for attending today. I'm very excited to introduce you to Dr. Hiba Zaaroura, a Daughters for Life Fellow who is completing her dermatology fellowship at SickKids Hospital in Toronto. Hiba is originally from Israel. She came to Canada in 2019 to complete her Advanced Medical Dermatology Fellowship program at the Sunnbrook Hospital through the Daughters for Life Fellowship program. Despite her very busy schedule, Hiba was very passionate about the webinar idea. She showed great excitement to share her rewarding and inspiring experience with us, and to mentor the younger scholars who are Daughters for Life scholars and other young women who are interested to learn about Daughters for Life. I guess, Hiba, are you ready to share your experience and to start speaking to our attendance today?
Yeah, sure. Good afternoon, everyone. I'm so happy. It's my pleasure to welcome everyone, the scholars, the guests for joining us. I'm so excited about the opportunity to talk to you. So let's dive in. My name, you already know, my name is Hiba Zaaroura. I am 35 years old. I'm married and have one kid who is 2.5 years Nader. I'm from Israel. I'm from a small village there called Raini in North Israel. I went to St. Joseph School in Nazareth. And after that, I went to med school at the Technion in Haifa. I did my residency in dermatology at Rambam Healthcare Campus in Haifa. And in my last year of residency, I started my Master of Health Administration degree at the University of Haifa, which I finished in 2019. Then I moved to Canada in June 2019, started my fellowship in the Advanced Medical Dermatology at Sunnbrook Hospital in July 2019. And I finished this fellowship in September 2020 and started my second fellowship in Pediatric Dermatology just a few weeks ago. Let's start about medicine, about my career in medicine. I would say that I have absolutely no regrets about choosing medicine, and I still find it an immensely rewarding career. So I encourage everyone who would like to be a doctor to go for it. The amount of the satisfaction that you get in this job is huge, and it's worth the long way that you have to go through to become a doctor. But you need to be aware that it's a job about dealing with people. So if you are not good at that, advise you not to think about this as your career. And you need to be aware that being a doctor is not easy. It's not a career for people who don't see themselves working many hours per week and on holidays. And it's not a career for people who are not good in responsibility as well. So why I decided to go to med school, many factors led me to decide to go to med school. Maybe the fact that I was feeling the satisfaction that my parents were getting in their job as a physician. But I guess the main factor that has shaped my personality and way of thinking and led me to decide about this was my sister Juman. Juman was born as a preterm, and she was diagnosed with cerebral palsy, which in her case caused a motor disability, and she cannot walk independently because of that. Her condition affected my childhood greatly. I remember spending it looking after her, maybe at the school, at home. And despite the complicated reality that my family and I had to face, I learned what happened. Just a minute. Uh-oh. Do you see me? Hello? Hi?
Yes. Hiba?
You're back. Now you're back.
Yes, you're back.
So as I said, my sister Juman and like I think this reality I learned a lot about the adaptation adjustment because of this, and I learned how to turn hardship into strength. So I think this is the thing that exposed me to the world of medicine, and which became my passion and eventually my profession. I am the eldest of 5 girls, so I've always tried to help my parents taking care of my sisters. And this taught me a sense of responsibility and independence and exposed me to the pleasure of helping. And since we are 5 girls in a community that they still consider sometimes girls are less worthy than boys, I have always been and still strongly motivated to prove to these people that they are wrong and make my parents proud. Upon graduating from high school, I left my village and enrolled in one of the Israeli's finest medical school at the Technion. I worked very hard to get accepted for med school. I had to get very high scores in my final exams, and in specific exam called the psychometric exam, and to pass an interview with 4 professional people. It was not easy. And I had to study a lot to get these scores, but eventually I was accepted, and I enjoyed the 6 years of med school, although also the med school was not easy and was challenging. Moving to another city, study in Hebrew instead of Arabic, many lectures, labs, and exams. The time the most students have to study in order to stay on top of things, and the amount of exams during the 6 years can be overwhelming to even the highest caliber students. My passion about dermatology started during my last year in med school, during my rotation in the dermatology department. Every aspect of dermatology attracted my interest. I like the fact that dermatology practice medicine, surgery, pathology, consult both pediatric and adult patients. And I was fascinated by the idea that we can make various diagnoses just by looking at the patient and knowing what questions to ask. I enjoyed the process of generating differential diagnosis based on the skin rash and the patient history. My residency in the Department of Dermatology at Sunnbrook Health Care was amazing. I have learned a lot. It was really great 5 years. And while I was pregnant in my last year of residency, I decided to get my Master of Health Administration degree, which I believed will help me a lot in my career. So I did this 2 years, a master while I was pregnant and on maternity leave. And to be honest, I was not sure that I can do it. I could do it with these circumstances, but eventually I did it. At that time, many people told me, "What, you're crazy, it's impossible, just give up, it's not the time for that, but it might be for you." Never listen to this kind of people, believe in yourself and have faith in your abilities. And I did it. I finished this degree with the highest score. After my residency, I desired to train in a clinically strong dermatology fellowship program, and I was aspiring to become part of a program that can combine my clinical and research skills so that I can make a worthwhile contribution to my dermatology field in my country. This is why I have applied to the Advanced Dermatology Fellowship Program at the University of Toronto. Then I learned about Daughters for Life from friend, and Daughter for Life helped me to arrange the scholarship, give me the scholarship for this fellowship. In the last year, I was a fellow in the Advanced Medical Dermatology Fellowship Program, which is a well-established program based at Sunnbrook Hospital and a Women's College Hospital under the supervision of Professor Shear. His department of dermatology is one of the largest training programs in North America, with over 30 residents in training at any one time. And the fellowship attracts dermatology fellows from around the world. They are from Israel, from Mexico, from Iraq, from Ireland, France, Japan, and many others. During this fellowship, I was exposed to many cases of adverse drug reactions, psoriasis patients, immunobullous disease, cutaneous T-cell lymphoma, and many other interesting skin diseases. And I have learned a lot from Professor Shear and the other amazing staff. And since recently I was more attracted to the pediatric dermatology field, I have spoken to pediatric dermatologists who had completed their fellowship program at SickKids, and I was fascinated by their experience. And this led me to be very eager to cross the same track and to apply to this program. So I applied and get accepted and started this fellowship, as I said, in the last few weeks. And it's an amazing and unique field that I believe will give me many tools to contribute to my country when I go back. Alongside my clinical experience, I was able to participate in dermatology teaching for medical students. And I attended multiple important meetings. So this fellowship will give me unique access to new resources, to support and professional network that will allow me to cultivate my skills and experience in a better way, and to improve my career. And I think working with other fellows from other countries also contribute a lot to my education and will affect my medical approach and my approach in general. I still remember my first day in Toronto, which was June 7th, 2019. I was nervous, but I was excited about the new experience. It's the new country, the new apartment, a new job for me and my husband, new daycare for my son. I can't deny the first few weeks were really, really tough. The job itself was hard. There are the new system, the different guidelines, the different drugs, dealing with patients from different culture. Moreover, working until the evening when you have a toddler was challenging, especially when you don't have a family nearby to rely on. I knew that it would not be easy, but I believe it would worth it, and I will make a breakthrough in my personal and professional growth. I had to work very hard in an organized way and make friends around me to support me and help me. And I believe to succeed, you should always be honest, modest, and hardworking, and has a good relationship with your colleagues, and to try to have a pleasant personality and get very well with your peers and patients alike. And you should be passionate about your work and always willing to take new challenging and responsibilities. This is exactly what I was doing. And these were, I think, the crucial factors for my success. I believe that the motivation is the key to innovation and teamwork. So I work to stay motivated and keep people around me motivated by establishing definitive goals. And when we get them, I make sure that we celebrate the achievement. So how did I make new friends or connection when I first arrived? In my case, I have already known people who live in Toronto. With this knowledge, I had the opportunity to reach out them before I move and reconnect once I arrive, or just as simple as I meeting people on elevator with kids, exchange a phone number, plan a play date. The kids will play, and you get to know new people with different culture who were born in Canada or moved many years ago, who more familiar with the city, can give you many simple tips that will help you, like from where to buy the best meat, from where is the best playground, or so on. In terms of connecting with my colleagues as well, I just learned about their life, their dreams, their culture, or in our lunch breaks, or maybe in the weekends, just go for coffee, or invite each other to our traditional meals and stuff like that. Just anything to get out the route of everyday work and have conversation in different place. It's good to talk to the coworker when they are a little more relaxed, and I also try not to miss social events that help people to get to know each other in fun settings. Like, for example, my case last year in the Christmas, we had a Christmas party and we had some kind of escape room. So it was nice to work with the staff and with the other colleagues and to try to solve problems which are not medical ones. It was a really nice experience. Yeah, if you have something like that, just don't miss these kind of social meetings. Also the simple thing, just don't forget to smile. Like, many of us don't realize how grumpy we can if we like just go to work without smiling. Smile before you say hi. It makes a huge difference, especially when you are building networks. So yeah, this is what I think about my experience. About my Daughter for Life, I was very happy and appreciative to learn that I was selected as one of their recipients of Daughters for Life scholarships. This organization played a crucial role in my future career. As I said, after my finishing my residency, I was searching for fellowship to get more advanced knowledge in my field, and Daughter for Life made this dream come true and helped me to get a position as a fellow in the Advanced Dermatology at University of Toronto. And my year in this fellowship was amazing, and now I guess my second year will be amazing as well. Daughter for Life supported me since the first day. Jacqueline always sent us emails to check how everything. Professor Abul-Aish and Dean Abul-Aish and his family always ready to help and support with anything they can provide. A Daughter for Life is my family here, and words are powerless to express my gratitude. So thank you. In terms of challenges, as I said, like, I had many challenges, just starting by, which I believe I went through them successfully, starting by getting the high scores to get accepted to med school, then finishing med school. I was passionate about residency in dermatology, which is really extremely competitive residency, and especially in Rambam Hospital. And after that, finding this fellowship in the Advanced Medical Dermatology, and in my second fellowship in Pediatric Dermatology. And today, after 18 months, I can tell that I'm having great fellowship, and I will recommend this program to others. I believe when I come back to my country, I will have more knowledge and experience as a result of this period of my life, and I hope I can bring some of the positive aspects of the Canadian system to my practice. And I will continue to work on research with my new tools and unique network of dermatologists which I can collaborate with. And I will provide mentorship to junior residents and students, beside my clinical interest with my Master of Health Administration degree. I hope that I can administer dermatology clinics that can give the most specialized treatments. I'm grateful for Professor Shear for his support and mentorship through these months, and I'm grateful for Daughters for Life for this opportunity. And one of the most valuable lessons I have learned during this period is how to be more efficient. I have learned how to succeed to coordinate between working, learning, and taking care of my family. I'm happy that I'm doing what I love. So I really think you should choose your future job wisely so you can enjoy it, because time does indeed fly. So you would like to spend it in something that you love. And to summarize, as a professional woman, it was not easy for me to adjust to all these new stuff with toddler and with my busy husband, who are also physician, who is doing his clinical fellowship in nephrology with minimal hours at home. This was challenging, but life without challenge is life without desire. So I have succeeded to care for my family while I was doing my job in the best way. I knew it was hard to adjust, but I chose the long and the hard way, and I'm so happy with my decision. For me, the definition of success is learning something new each day, and I'm learning many things new recently. So I will tell the young girls who were unsure of pursuing their education to never give up. You must continue your education for yourself, for your community, for your family. It will not be easy, but like good things never come easy. And I believe that the women education is so important, and volunteering for your community is important as well. And it benefits not just you, it also benefits just others, just like also ourselves. And Daughter for Life made me appreciate these values much more and fight for them and teach them for others. I guess that's it. I would like to thank Daughter for Life again for their amazing work, my parents and my sisters who supports me even when they are far away, my amazing husband who always support me and proud of me. And I want to thank the scholars for attendance. And I would just like to want to tell you, work hard and dream big. And thanks for the guests for attending. And happy National Mentorship Day. And I will be more than happy to mentor the scholars that need mentorship and to give whatever I can give. So thank you.
Wow, thank you so much, Hiba. Sharing your experience is truly mind-blowing. I guess everyone enjoyed it. As of now, like, we will be starting our Q&A session. Some of our scholars have prepared some questions, so I would just appreciate whoever I will call her name. Please unmute yourself and ask your question and listen to Hiba's answer. So let's start with Isra's question. Isra, you can go ahead if you'd like.
Okay, hello Hiba. That was so inspirational. Thanks for giving us this speech. I just want to ask you, how was your experience working in an interprofessional team? You know, that consists of nurses, pharmacists, dietitians. How was your experience? Because sometimes working in an interprofessional team comes with some challenges. So I want just to ask if you like to share your experience with us. Thanks.
Yeah. So as you say, like interprofessional people, like all of these interprofessional people are part of your team, and without him or her, the job won't be complete, and everyone is doing his best for the same goal, which is the best results for the patients. So if we are aware of that, that our job as a team, then our job as a team is much more easier and efficient. And I think that a key, the key for the success in this situation is to have one leader who is in charge of the case, if the case needs many people to be involved in. This person can coordinate between the team members, and everything should be organized and documented and available to other team members. In my job, I have many examples that I have to work with other interprofessional people, and without them, I couldn't do it. Just like in the last week, I can give examples for many cases of genetic skin diseases that I need to collaborate with the genetic counselor with the patient. Without them, I couldn't give them the message that they need and give them the future planning. Or just like there was the kid with autism who had lesions on his hand that I can inject or give creams to solve this, but these lesions are just a result of a chronic rubbing. So if we don't collaborate with behavioral therapy and make really a good communication between both of us, we cannot resolve the problem. It's need me and her to work together, and to get otherwise nothing will be good for the patients. So I'm good with that because I'm aware that how it's important, and I think everyone who care for the patient will work together very well. Thank you for the question.
That's a good question, Isra. I guess the second one is Eva.
Okay, hi everyone. My name is Eva and I'm from Egypt, and I'm studying at York University biology in my final year. I want to start off by thanking Dr. Hiba. This was amazing. The hardship hardships that you've been through and how you overcame those hardships. It's very inspiring since we're having similar hardships, like in communicating with others. I just have a question. So when you first started to have an interest in dermatology, or you decided to specialize in dermatology, did you have other things in mind when you went to medical school and you wanted to specialize in, and then you decided to change your mind and specialize in dermatology? Or like, what inspired you to choose dermatology to specialize in?
I guess it's not something that I was like thinking about since my first year, to be honest. I just started to think about dermatology in my last year, as I said, when I was in the rotation there, because I found it very interesting. I was not sure yet. I tried like in our last year, the internship, we have a 2 months that we can choose where we want to be to check if it's something that we like or not. So I remember that I chose 1 month in dermatology and the other month I did in the ENT, the ear, throat, and nose, which is my father specialty. I was thinking maybe I would like to go there, but after like the 2 months, I said no. It's nice, it's really interesting, but the dermatology was for me much more much more interesting. It's like I think it's something personal, but you will just get it when you try. Like always give yourself the opportunity to check, and just to, like I say to everyone in med school, you will not know until at the end of the med school or even in your internship. So just take your time, because it's something that you will have to deal with all of your rest life. So take your time.
Great question, Eva. I believe Rasha has a question for you, Hiba.
Yes. Hi, my name is Rasha. I'm from Jordan. I'm in my second year at York University doing commerce. I was really inspired by what you said, and like it's really encouraging to see what you've been through, especially when you did your master's while you were pregnant. That's a lot, and like I'm amazed by how you did it, honestly. And my question for you is, how did you integrate yourself into the job market, and how did you prepare for it after you graduated from medical school?
I'm not sure that in this case, like in the job market, in the medicine, it's like the other job market. Maybe it's the same in terms you have to be good in what you are doing. It's in everything. In my case, I think we need 3 things. The first thing that you need is to be a good dermatologist or good doctor in whatever you are doing with good CV. The second thing, you have to be a good person with your patients and your colleagues, and you have a good reputation and network. And the third thing, I guess, is you need to specialize in something that there's a shortage. And lucky me, I have specialty where there is such a huge need. And I think I'm a good dermatologist and nice with my patients. So I have no problem to get the position that I want. So my tips for you is to search for something that you love, but also there is shortage of it, or at least not too many. And be great on it. And that's it.
Thank you.
Thanks, Rasha. We have 2 questions, Hiba, from some of Daughters for Life community members. Joy, do you have a question? You can unmute yourself.
Hi, Dr. Hiba. I just want to say that story was extremely inspiring, and it was very impactful as well, considering all the decisions and challenges that you had to overcome. So my question was, when you were doing your fellowship, did you consider doing it in the US or only Canada, and why?
I guess I didn't think about it a lot because when I was thinking, I just met Professor Shir in one of the conferences in Israel. And I heard that he's a great mentor and he's well known as one of the best dermatologists in America. He is one of the most highly sought after speakers at international conferences. and advisory boards, and he is the most published Canadian dermatologist. And like, I was thinking that to be mentored by him is such an honor. And I heard that his fellowship gives the dermatologist the most efficient and updated approach for most of the complicated skin diseases. So since I already thought that it's the best thing that I can apply for, and I was accepted, I didn't search for more than that. But I guess it depends on depends on the specialty that you are searching for. So just make sure that you are going to the best place in this area. I think like US and Canada both of them are as good, but depends which hospital and who is the mentor. I think this is what will make the difference, not if it's US or Canada. I guess also there's a difference in terms of exams. Canada doesn't ask us to have the USMLE, which you have to have these exams to do a clinical fellowship.
Okay, thank you.
Thank you, Joy, for your question. Our last question will be from Tasha. Tasha, can you unmute yourself?
Hi, my name is Tasha. I'm from Palestine. I'm studying at Laurier Global Studies major and management option. My question for you is, how did you create your goals and how did Daughter for Life help you to reach them?
Create my goals, I guess, you search for the things that you love, and from there your goals, you build your goals. So you search for something that you love and you try to make it as the best way that you can, and try to something that you love but that will make a difference in your community, something that they need, something that if you will do will make a difference and will give you satisfaction and reward. So this is how I just was decided. As I said, I decided about medicine and dermatology and my fellowship. And Daughter for Life came my dream to be true after getting this fellowship, because I really wanted to have this fellowship. So they really helped me with that. So yeah, that's what I think.
Thank you, Tasha, for your question. I believe we are done. I would like just to thank everyone for joining Daughters for Life first webinar and listening to Hiba's story. Thanks to our scholars, board members, supporters, and community who joined us today. We love talking to our members and to talk to our Daughters for Life community, especially during this time when we cannot hold any events. This is the time we usually used to hold our gala dinner every year. So we thought it might be a good idea to get together in this insightful experience. Thanks and big thanks to you, Hiba, for making it today and for coming to speak to our community and to the young scholars and sharing your experience. We couldn't have this webinar without you. Thank you all for joining today, and wish you a great rest of the day. Thank you.
Thank you so much. Have a good day, everyone.